Attorney General Rob Bonta announced the lawsuit late Friday. CBS 8's Shannon Handy has details and reaction.
Effective this Friday, Rady Children's Hospital will no longer provide gender-affirming surgeries or prescriptions for minors. When asked for specific guidance, they wouldn't say where patients could go instead. A local advocate says there aren't many options.
These families feel devastated, they feel betrayed, they feel lost.
Kathy Molig is founder and executive director of Trans Family Support Services. She knows exactly how families are feeling about Rady Children's decision to end gender-affirming care for minors because many have reached out asking her for help.
What has the response been in terms of people reaching out looking for alternative places for care?
Hundreds.
Molig says Rady Children's has about 1,000 patients in its gender clinic and another 300 at Children's Hospital Orange County, who they just merged with. Right now, she's trying to guide them on where to go, but the options are slim, with some being far away.
Rady's is one of the largest pediatric serving institutions we have in Southern California. Really, the closest care we can connect people to is going to be LA County.
Molig says Kaiser is the only healthcare provider in San Diego County currently providing gender-affirming care, but that's only available to Kaiser patients.
Even sending people to the doctors that we have in other parts of our state, you're then having to deal with your insurance company and fighting them to see a doctor outside your network.
Rady Children says the decision was difficult, adding it was guided by our responsibilities as a nonprofit pediatric healthcare system to continue serving all children and families across our communities, including through participation in essential federal programs. Late Friday, Attorney General Rob Bonta announced the state is now suing, saying the move violates binding merger conditions requiring those services to continue through 2034.
We are so pleased that Attorney General Bonta has, in fact, stepped into this issue.
Molig, whose son was one of the first patients Rady Children's ever treated for gender-affirming care, says though hopeful, she does worry about the immediate effects on patients. She notes surgeries for minors are extremely rare, but that many do take medications, which when stripped away can be harmful both physically and mentally.
If you're not taking either the puberty blockers or the HRT, then your body does in fact go back to reverting to natal puberty, which is medically taxing on your body and so mentally distressing for our kids.
Shannon Handy, CBS 8.